I'm going to get right into it, but first I want to thank the organizers. This is a really amazing conference. Thank you. Very briefly, I'm going to be framing the problem, then discussing our methodology, and then discussing results and analyzing those results. So framing the problem. My laboratory investigated how confronting death impacted the mental health and existence of cancer survivors via phenomenologically grounded qualitative analysis. We did 19 semi-structured Zoom interviews, all approved by the University of Illinois ethics panel. And we employ Heidegger's being towards death. Obviously, this is a natural fit. Heidegger unapologetically analyzed confronting death and how that shifts your experiences. And indeed, for this precise reason, Heidegger's analysis has served as the cornerstone of death studies and qualitative phenomenological analysis for a very long time now. Core problem. In death studies, Heidegger is frequently invoked, very rarely understood, and even more rarely correctly applied. This is very evident from the literature. In 2020, Golick and West did a literature review looking at all articles from all time that used Heidegger in qualitative analysis and found that none of them applied Heidegger's analytic at all, even when it was found in the data. This is also the case from Zahavi's analysis of qualitative analysis. As Zahavi has shown, Zahavi and Martini here, most people take Heidegger in commonsensical ways that misrepresent what he is about and how he can be applied. So, our intervention. We qualitatively investigate confronting death by taking Heidegger seriously. We correctly understand Heidegger. We go through rigorous readings of Heidegger, informed by canonical secondary sources, and then we attempt to apply Heidegger appropriately through our interview structures, or through our interview design from the start, and through our analysis of the data. Essentially, we treat phenomenology as the generative source of our study. A lot of the time, almost all of the time, when phenomenology is used in qualitative research, it's used as decoration. Give the appearance of erudition while the study and the results remain superficial. We're trying to change that. And I want to emphasize here my commitment to the fact that phenomenology should only be employed in any empirical study when it aids that empirical study. Only when phenomenology can augment or correct the results of an empirical study should it be employed. Often phenomenology is discussed as something that should be preserved for its own sake. While I am a phenomenologist, when converting the concepts and ideas of phenomenology into empirical research, it should only be used when it can help the study. How to do this? We use phenomenologically grounded qualitative research, recently invented by two of Zahavi's students, Alan Koster and Anthony Fernandez. I also have some forthcoming publications that try to refine their method. So together, Zahavi, Koster, Fernandez, and myself are really trying to push a new paradigm for how qualitative research can be accomplished using phenomenology. So step one, we have to understand Heidegger. How can we do this? So for Heidegger, being towards death names the fact that life is structured by death. So it's not, being towards death is not about some event at the end of my life, my possible demise, but rather it's fact that through and through, life is shaped from the beginning by the certainty of its end. We live our lives in the knowledge, sometimes clear, often hidden, that they are fragile and finite. Every friendship, every moment of joy, every struggle unfolds against the horizon of its ending. To live is to live impermanently. To speak of being towards death is to speak of the way life is lived as fleeting, not in spite of this, but through it. Our finitude is not a shadow cast over existence, but the very light that allows it to shine. So, looking more closely at what Heidegger says, being towards death can be authentic or inauthentic. All philosophers here will be familiar with this distinction. Very simply, I'll bet authentic being towards death is an authentic relation to death, which reframes life in an authentic way. So being towards death is not just about understanding death, but also about how we live our lives. Naturally, inauthentic being towards death is how we relate to death, is when we relate to death inauthentically, framing life in an inauthentic way. To investigate being towards death, one must focus on different structures of experience. And in our study, we looked at attunement and understanding. So what is understanding? It is not something about thinking or conceptualizing. It is the fact that life is structured as oriented towards the future. We exist as beings who are future-oriented. We always exist with our future in mind. We plan, prepare, and act in accordance with our future existence. There are two different ways that we can understand death. These are inauthentic expectation and authentic anticipation. Shed your common understanding of these terms. I'm going to provide a little bit more definition of them right now. To clarify inauthentic expectation and authentic anticipation, I divided them down, simplify them into three questions: when, who, and what. In expectation, okay, first with regards to the when, expectation, death is deferred to an old age. I understand death as something that will happen at a very late point in time, after I've lived a full life, have a full career, after I have grandkids. It has nothing to do with me right now. In contrast, in anticipation, I recognize that death can happen at any moment. The ceiling could collapse, and I could die right now. We all could. Who? In inauthentic expectation, others die. Acquaintances die. People are dying all the time, but by no means will I die. Who, in authentic anticipation, my death is mine. I will die. And then what? And this is the kind of key to the study. In inauthentic expectation, death is another event in my longer story. There are children or accomplishments that carry my legacy. In authentic anticipation, death is the end of all possibilities. I have no more story. All of my possibilities come to an end. And then step 2 is to formulate questions on or about these modes of understanding. So, results. With regards to when is death, most participants authentically anticipated death as something that could happen at any time to them after having their cancer diagnosis. This is not a picture of Monica, obviously. So Monica said, we all know we're gonna die, but then I realized, oh, I'm gonna die like at some point, and it might be soon. And that's just a reality. Whereas before, it didn't feel real. It feels like, well, I'm gonna die, but when I'm like this old woman who's in her 80s and after I've seen my grandkids and whatever, and then that was like, oh no, I mean, it's now. Now's the time like I could die. Moreover, most participants after having their cancer diagnosis came to authentically anticipate death as I am the one who can die. Maria, again, not a photo of Maria. So I've definitely thought about that, my mortality. I've never considered that it could be me, though I always thought it might be someone else in my family. And then it's like, oh my gosh, it's me. So it definitely makes you look at your own mortality differently. Yeah. And then what is death? This is the key to the study. You can ask me about the Mike Tyson photo in the Q&A if you want. If you haven't seen the video, I recommend it. I wanted to talk briefly about this question, what is death, and what Heidegger means when he says that death is the end of all of my possibilities. So when Heidegger describes death as not to be outstripped, he means that death marks the absolute limit of my existence. To say that it cannot be outstripped is to say that no possibility remains beyond it that could still belong to me. Whatever might continue after my death, children, reputation, legacy, even religious assurances of eternal life, no longer count as my possibilities, because I will no longer be the one who lives them. Death is the possibility that brings all of my other possibilities to an end. Results with regards to what is death. Most participants inauthentically expected death by not recognizing death as their end. They understood death as something that could be outstripped. something they could go beyond. We often saw a retreat into familiar cultural narratives, legacy, memory, and symbolic survival that soften death's finality. In these moments, participants appeared to flee from death rather than confront it. For example, Karen, rather than confronting death as a definitive end, leaned into the reassurance that life, through family, faith, and divine order, would continue without her. She says, and when I got out of the PET scan machine, I realized I just had to believe it was going to be okay. Even if the cancer won, my kids would be okay. My husband would be okay. Life would keep going. I needed to trust that God had all of this in his hands, that there was a bigger plan I was a part of. That helped me not stay stuck in fear. Even if I wasn't here, things would still work out. God would make sure of it, even if I couldn't see it now. And then a very brief discussion. So despite growing interest in existential issues within palliative care, experiences such as anxiety, disorientation, shifts in value, and symbolic meaning-making are often still interpreted through clinical or normative lenses that obscure their existential significance. This is not a matter of clinical insensitivity, but of conceptual framing. Without a grasp of Heidegger's account of how mortality can reshape lived existence, caregivers may misread existential disclosures as symptoms of disorder. Many participants, again, just to highlight the point, many participants, with regards to what is death, turn to symbolic frameworks, legacy, religious belief, or reassurances that family would carry on. These are often treated in clinical settings as signs of resilience or spiritual health. In fact, there are many clinical orientations, such as terror management theory, which encourage such symbolic strategies to manage death anxiety. I'm just going to grab my water. In fact, terror management theory claims to be based on Heidegger's being towards death, but they have absolutely no idea what they're talking about. From a Heideggerian perspective, this is misguided. My lab contends that clinicians should hesitate to encourage symbolic continuity as a therapeutic goal. What may be needed is care that allows patients to dwell, however incompletely, with the fact that death is truly their end. This follows, we understand this is a bold claim and may increase suffering. This follows directly, however, from Heidegger's depiction. If death ends all possibilities, then symbolic survival defers rather than deepens our relationship to finitude. To help patients confront death as their final end may allow them to authentically understand what death is, thereby helping them to face death unafraid and resolute. To conclude, in sum, if one holds that existence itself matters, that what it means to be is a question worth asking, then the task is not to shield patients from finitude, but to accompany them as they learn to dwell within it. That such dwelling may involve suffering does not invalidate it. It may, in fact, be the beginning of something more healing. Thank you.